Welcome to the Big Sis Little Sis podcast. I'm Elle.
And I'm Ruby.
And we're two ethnic sisters here to talk about all things culture, feminism, and business.
Join us for weekly unfiltered and unapologetically female opinions and join in on the conversation. Hello, everybody.
Hi, welcome back.
I know it's been like, what, 2 weeks?
It feels like it's been longer, but it has, because we were just so busy last week.
We've just had the most hectic couple of weeks. And so we apologise for not showing up last week, but this week has a really juicy episode. Tell me, Al, what have you been up to the last few weeks?
What haven't I been up to, Ruby? I've actually been really busy. I don't know if you all know, I am an entrepreneur, so starting new ventures is always there, and I've been involved with a few new projects. So the 4 a.m. wake-ups are happening, and it's been busy, but I love it. So I've been good. And how about you?
Oh, I'm tired, Al. I'm so tired. Just for everybody out there listening, I just want you to know February has to be one of the worst months for our family.
I know.
Just in terms of busyness, like how many birthdays do we have in February?
So we have four.
4 birthdays.
And mine is coming up next week.
4 birthdays, 2 anniversaries, and Valentine's Day. And it's just like
back to back.
It's hectic, but I've been good. I am officially back on the road with work, which has been fun. Given that I didn't have a car up until yesterday.
Yes,
so
she got a new car.
I bought a new car, which is really exciting, but for the last 2 weeks, it's quite funny. So for those of you who don't know, I'm a medical rep, and basically what my job is to do is to go out to different doctors' clinics, chat to the doctors, educate them, etc. But it's just quite funny because, you know, I'm dressed in these really corporate clothes, and I go out and I have these really professional conversations, and then I come back and I jump because I have to leap into this thing. It's a 4-wheel drive Prado, and I dive into it, and I started up like, and I just look like this.
And they all turn around, they're like,
everyone's
what?
Everyone's looking like, we thought that was a guy's car. Yeah, it is a guy's car, it's just me driving it.
A guy's car. Please. This is a feminist podcast.
No, are you kidding me? Do you know how hard it is to steer that thing? My arms are so toned because it's like a bus.
I just don't think it's an appropriate city car or a work car.
No, it's not. It's
definitely a camping car.
It's a great camping car, and that's what we usually do with it. We take it out for 4-wheel driving, camping, and usually I just sit back and enjoy the ride because I don't really like to do long haul drives. But it's funny because, you know, we're now living in the city, and this huge car, it doesn't fit in our garage, right? So every time we go in and out of our little apartment garage, it actually hits the clearance sign. Oh. And everyone turns around. It's quite embarrassing,
What are you doing with this car? We did go camping as well.
Yeah, we did. We had a really nice camp with the kids. That was fun. So, yeah.
And it was storming the whole night.
Oh, no. Everything was drenched.
Oh,
the worst.
But all good. It was really fun.
But, yeah. So that's been the last few weeks for me, basically.
All right. So, Ruby, what are we talking about today?
Today, Al, we are talking about medical sexism.
Now, I don't know if this is a term any of you have heard before, but it's real.
Yep.
And it's happening. Okay, so Ruby, when I go to the doctor, I don't want my hand to be held. I don't want that warm and fuzzy feeling. I just want a doctor who's really good at their job. Part of being really good at your job is listening to your patients, to what they're saying. Oh, okay. So you're probably thinking a lot of things when you go to the doctor. Am I okay? You know, how long is this going to take? How much is this going to cost? But I bet you guys out there, you don't go in thinking about whether your gender is affecting the care that you received.
Absolutely.
No. So why should it matter? If you're a woman or a man who cares deeply about a woman, you should. Because it turns out healthcare is sexist.
It really is, Al. And it's what's really sad is that, you know, when we were researching for this topic, just like example after example of, you know, really fucked up shit that's happening to women out there when they're being treated by a healthcare professional.
It's pretty sad.
It's disgusting. So look, you know, this is what we want to talk about today, and, you know, how to recognise when you are being treated sexist and what you can do about it. So, you know, you should never be undermined by a healthcare professional. Their job is to treat you for your medical problems.
Yep.
Right? And treat you objectively.
Now, for years, medical research was centered on men, Ruby. Women were literally left out. Studies show doctors don't take women's healthcare concerns as they should. As a result, women are too often misdiagnosed, and it may take years to be treated. So medical research excluded women. So I was listening to a doctor. She's quite an amazing woman, Dr. Janine Clayton. She's the director of the Office of Research in Women's Health. And she talks about how women are often underdiagnosed or not diagnosed at all. And it may be because the way they employ tests that are used to diagnose a disease were based on studies done in men, or were targeting disease patterns that occur predominantly in men. And I love the example she gives. So the gold standard test for detecting heart disease is called a pulmonary angiogram. Now, that test detects a clear pattern of narrow areas in the major blood vessels in your heart. Fortunately, sometimes women have heart disease that has a pattern that has a normal large pulmonary arteries, normal pulmonary angiogram, but abnormal small blood vessels, or macrovascular disease. So that diagnostic test that they use as the gold standard, Ruby, the gold standard, is more likely to detect the pattern of disease that is typical for men. And, you know, that's one of the reasons why more women are dying from heart disease than men are.
Because it just doesn't present the same, and you can't treat them the same, which is what Janine is saying, right?
Exactly.
Yep.
So, and moving forward, now, half of the participants in these clinical research institutes now do, also include women, which is great. So, there is a move forward.
Yep.
But the problem still lies the fact that these scientific journals, that publish the results, are still not separating man from women. They're combining the results and they're releasing them, in this way. So again, doctors don't have the information, so they can distinguish, different factors, different issues, for a man's body and a woman's body.
I think that's a really great example of, historically where the problem lies with, sexism in medicine. But, we're thinking about now, well, what else is there? And, I'm thinking about doctors who traditionally maybe are a little bit sexist and misogynist towards women, the ones who think that your pain is not real, you're just being hysterical and dramatic, get over it. So there is so much research out there, Al, about, how women are being undertreated and underdiagnosed for their chronic pain.
Yeah.
And now chronic pain is huge. It affects so many people in Australia. I used to work in chronic pain medications with work, and I know exactly how prevalent it is, and it's really sad because it affects so many people, and there's really no solution for it. Chronic pain is chronic pain.
Yeah.
You just deal with it. But how are our medical professionals dealing with the women who experience chronic pain? And research shows that women are more likely to be undertreated for their chronic pain and not taken seriously, despite being more often diagnosed for chronic pain than men. And this is actually something that, one of our listeners reached out to us about. And she was basically, seeing a doctor who said, it's just period pain, get over it, like just, Panadol and Nurofen, just the standard stuff, totally ignoring and being blasé about her conditions.
Yeah.
She later saw a female GP because, this man was not doing anything for her. She was then diagnosed with endometriosis. She was now seeing specialists, and she has a great care plan with both her doctor and a specialist. And it's being managed now. All because that guy thought he knew better about the woman's body and said, nah, you're being dramatic.
You're being dramatic. You'll be fine.
And look, obviously this story, I'm really happy for that listener because they got the care that they deserve. But, I just stop and think, Al, for every one of them who has a happy story, how many of them are just being, stopped in that train track by that doctor and saying, I guess I am being dramatic and I guess my pain isn't that real.
Exactly.
And they're just continuing to live life undertreated, undiagnosed. This is just one example. Unfortunately, there are so many examples of this type of, undertreatment, undermining situation. I don't know if any of our listeners use the forum Reddit. If you do, I highly recommend you check out this page called 2X Chromosomes. You will find a story about a woman being undermined and undertreated for their medical issues literally every 10 seconds. It is just a great feminist platform. It's a great forum if you want to know more information about feminism. And it's just so damn common, Al. And look, it's something that I experienced as well. So this one time, Al, I think I may have been about 18, maybe 19 at the time, and I was experiencing really bad periods.
Yeah.
So my periods were really heavy. I was having
a lot of women do.
It happens, right? And so, like, not just that, but the cramping was bad, and I was also having a lot of cystic acne as a result as well. So like these huge cystic acne boils basically on my body.
Yeah.
And so one of my girlfriends said, "Oh, hey, that used to happen to me," and then I jumped on the pill and it cleared the whole thing up. So I said, "Yep, that's a great idea." Now, obviously, given the community that we come from, I was just like, look, I'm just going to go and do this in private because you know what contraception is like. People get the wrong idea, basically. So I went to the doctor.
What was the ethnicity of the doctor, Ruby?
He was Lebanese.
Okay.
He was a Lebanese male doctor. He was an international guy, so he wasn't Australian born. And he was in his 50s, I would say, at the time.
Mm-hmm.
And look, I sort of just made an appointment spare of the moment. And look, this is probably a good indication of a pretty shitty doctor is when they have lots of availability. So this guy had a fully empty day. So that should tell you something.
It's like an empty restaurant. You kind of go, there's
100%.
a reason why it's empty.
Exactly. And do you know what this fucking asshole said to me, Al? He said to me, "Oh, are you having sex?" And I said, "Oh, no, I just have this and this issue." And he said, "Well, this pill is for people who have sex, so I can't give it to you." And I said, "What?" He's like, "No, this is only for people who are in relationships."
That is disgusting.
Yeah. So
I'm sorry.
he refused to give me basic contraception so that my hormones can balance because apparently it's for people who have sex only. I was floored.
Wow.
I was like, are you fucking kidding me? I went back and saw a different female doctor.
What a dickhead.
Who sorted me right out. My acne cleared up. Happy days.
Yeah. Yeah, and I mean, do you find that perhaps the fact that he was ethnic had something to do with his response?
Absolutely it does, to some extent. And I'm not going to say it's every doctor who's ethnic because it's not.
No, of course not.
However, I think, when you are extremely culturally bound, you start to lose some of that objectivity towards your medical profession. And in this case, he was being extremely subjective to me. He was projecting his own beliefs onto me, and he wasn't doing his due diligence as a doctor.
He wasn't doing his
They
job.
have a duty of care, and he didn't provide me with that duty of care. Now, being young, I didn't know how to react to this. I was just like, well, okay, and I saw someone else, but if that happened to me today, you bet your ass I'm going to file a complaint about that guy refusing to give me basic treatment.
So you should. There was a study that I came across, Ruby, which I found really interesting. And the study was based over a 20-year period in a hospital in Florida. And it states, among heart attack patients admitted to Florida hospital over the 20-year period, female patients having a heart attack treated by male physicians had higher mortality rates than female patients treated by female physicians. And then the study went one step further, and they just looked at the proportion of women physicians working in these emergency departments, and they found that when there was a high proportion of women physicians, male physicians did better in outcomes for their female patients having heart attacks. It is so interesting. It blew my mind.
Wow.
Yeah. So, like, basically, in the corporate world, you would diversify the workforce in terms of gender, racial and ethnic, minorities, and you find that the bottom line in the corporate world is really your financial returns, and they improve. But, in healthcare setting, the bottom line primarily is patient outcomes.
Yeah.
So, the research found that diversity in the workforce in these hospitals actually improved outcomes. So I think part of the answer, Ruby, is more women physicians.
Yes.
So 2 out of 3 doctors are still men. Now,
Tell me why it's a problem.
Oh, let me tell you why it's a problem. Okay, so the National Academy of Science and Engineering and Medicine came out with a report, Ruby, that showed that in academic science and engineering and medicine, there are very high rates of sexual harassment. But it's worse in medicine.
Right.
And they reported in the research that by the time women graduated from medical school, about 50% of them had experienced sexual harassment, and this is a fucking problem. 50%, Ruby, of women who are out there to become doctors are being sexually harassed.
And just to point out, they're being sexually harassed by their peers.
By their peers.
But going into the fucking medical field. Are you kidding me? So
I
these are the
know.
people, these harassers are the ones becoming doctors and surgeons.
Yep.
And perpetuating this problem.
And misdiagnosing us.
Oh,
All right, so
sucks.
it's a clear organizational problem.
Yeah.
And when you have male-dominated, male-led environments, it's basically like a very rich petri dish for harassment to occur.
Yes.
Okay? So the downstream outcome of harassment is that when you have been harassed, it is the number one thing that impacts women's careers. So it's just, I don't know, Ruby, I don't know, like it stems from, studying medicine, and then, we want to be treated equally, or we want to have better, treatments from doctors. But yeah, women being harassed whilst becoming one, it just blew me away, to be honest.
It's really sad.
So when they are, sexually harassed, and this is a known fact, exposing people to harassment, they feel demoralized, they're not as engaged, and women are taking a step down from leadership positions due to these harassments. So looking at the report, Ruby, it derives from the culture of medicine for women. And I really think we need to do a profound change in the culture of healthcare before we can fix the problem of getting more diversification in the workforce, so that we can fix the problem of having poor treatment and, outcomes for women.
So that forum that I mentioned earlier has a few really good examples of, doctors undermining patients and, finding an excuse for everything, basically. This one woman writes, "I lost 75 pounds so doctors would stop blaming everything on my weight." Isn't this so true?
Wow.
I mean, I have a lot of friends who go to doctors for their medical conditions, and the first thing they get told is, lose weight.
Yeah.
And look, this is a really valid point for, some things where it is affecting your condition. I know when I used to work in chronic pain, losing weight was number one advice, because, obviously it's putting pressure on your joints, and, alleviating that pressure would help with the pain. However, this woman lost, 75 pounds, like 30 kilos or something, I don't even know. But she lost all the weight. She went back to the doctor, who said, "Wow, well done on your weight loss. Have all your problems disappeared?" And she said, "No, they haven't. So can we now find a fucking solution?"
Oh, wow.
And guess what? They started doing the tests. They did an MRI. They found her problem. They diagnosed her. Why? Because they started to actually appreciate the fact that there's nothing else that we can really blame here.
Yeah, they took her seriously, finally.
But it took her, this whole journey of weight loss just to be taken seriously.
Wow.
Whereas they would have diagnosed that if they had just done the fucking test.
I mean, good on her for losing the weight, obviously, excess weight is not a good thing. But the fact that she did it purely to get,
To get medical treatment. Right? It's insane.
That's sad.
And this other woman who basically had to go to the emergency room. Now, if any of you have ever had your appendix removed, you know what that pain is like. It's totally different to period pain and cramping. It's intense. One of my best friends had her appendix removed, and it was, really hard to watch her go through that. So this poor woman goes into the emergency room. She, she's a professional person. She's full-time working and whatever else. She goes in, explains, "Hey, there's something wrong here. It's different to what I usually experience with my period. But they just stopped and said, no, we think this is period pain and we're going to not treat you for it.
What?
So they let her sit there for hours and hours and hours. And I think about 6 hours later when she said, can we please do a fucking scan or something, that they actually said, well, okay. And they came back and said, okay, get this. So they said to her, oh, we have some good news and bad news. The good news is that, you know, you really know your body well.
Oh, good.
Good
10
for
points.
You. The bad news is we have to operate. So she actually did have appendicitis, like she guessed.
Yeah.
And they, you know, she was
lucky
treated.
It wasn't too late, because I think it's like a ticking bomb, isn't it?
Look, I don't know what, you know, the time limits are, but it's just appalling that, you know, a woman can sit in the emergency room for 6 or 7 hours being untreated just because someone said, no, I think I know what this is. I think it's period pain.
Because, you know, you don't have your period every month, and, you know, you can't differentiate between a period pain and some other sharp stabbing pain.
And do you know why, Al?
You're experiencing?
Because women are dramatic.
Oh,
we're exaggerating the pain.
You know, we only birth children, you know. Of course we are.
I know. So it's just these type of examples, it blows my mind. And look, it goes both ways. This isn't just male doctors, you know, we're shooting all over basically. This happens sometimes with female doctors who are, again, projecting their subjective views. There is another feminist podcaster out there who we love and we follow. And she had some really good examples from her listeners about some of the sexism they were experiencing from their doctors, from women as well.
Do you have any examples there?
I do. So basically, from the men, of course, it's the typical sexist stuff that we already mentioned, but from the female GPs, they were being slut shamed. Basically, every time they went in to get, you know, an STD screen, they were being slut shamed by the female GPs.
Oh, wow.
They were, you know, being ridiculed if they asked for an abortion or if they asked for a contraceptive pill. And I think, you know, the whole abortion termination thing is really what grinds people's gears. Mm-hmm. If you are a conservative doctor, and it's something that I've seen before, Al, out in the field. You know, obviously I work with a lot of doctors, so I see all types of kooky characters out there, right? Yeah. And I can't tell you...
You have some pretty good stories.
I have some good stories. And one of the things that, you know, really upsets me, and look, I don't know how legal this is. I assume it's legal since they're doing it, but there are clinics out there who are really conservative who have signs plastered on their doors saying, if you are thinking about an abortion, don't come here. We will not see you. Just
what?
Flat out refusing it because it goes against their own beliefs.
Can they even do that?
I don't know, but they do. I don't know if they can do it. I would
like to find this clinic. I would like to report this. Oh my God, I did not even know they could. I thought they had to.
No, they don't give a fuck. They'll do whatever they want.
Wow.
Yeah. This one time, Al, and this is really something that has stuck with me, and I just feel so sad. This doctor who I used to see in Melbourne, in Flemington, I won't name names, probably one of the worst guys I've ever met, highly disgusting doctor, but I had to see him for work reasons. This guy, you know, forget patient confidentiality or anything, he would just love to sit and tell me stories, and meanwhile, I'm trying to get out of there, right? Like, I have a job to do, but he just wants to sit and chat. And he told me one time that he had a patient who was about, I think, 16 or 17 years old, young girl, and how she was unfortunately raped, and basically that she came in with her mum and she had all these tests. I think she was just having an STD screen or something. And he told me how he pulled the mother aside. He's telling me this very proudly, by the way. And he told her, oh, hey, I think it's because your daughter dresses are quite slutty. You know, you should tell her to stop wearing short skirts and then maybe she won't get raped again.
What?
Yeah, that's what he fucking said to me.
How are you a fucking doctor?
Disgusting. Absolutely
How
disgusting.
are you a doctor and we are meant to trust our lives?
Well, consider this, Al. Some of these people who've been practicing, you know, they've been practicing for the last 30 odd years. They're now in their 60s, right? They got qualified overseas. Have the standards of medicine changed since they got qualified in, you know, random countries 30 odd years ago? Yes, they have changed. So would we see this now from the young emerging doctors in their 30s? I think we'd see it a lot less.
A lot less.
But
although there's still 50% harassment, right? And it's probably those guys that you see, the disgusting ones that are doing all the harassments.
But it's just like, you know, these guys keep practicing. They practice for a long time. And, you know, just for you guys out there, in order to stay a doctor and continue to have your medical license, it's really not that hard. So they have to collect a bunch of points, basically. It's like a point system. And in order to gain those points, they just have to come along to these meetings, eat the free food, sit and pretend to listen.
And request their food.
Just sit, pretend to listen, and there you go, here's your points. And this is how they get by, basically. Wow. They're not really that up to date. And you can honestly tell the difference with a doctor who actually gives a shit about new information and staying up to date with the latest techniques, because they're the ones who are engaged at these conferences.
You should put like compile a list of engaged doctors, the ones that are up to date.
They are. It's so nice. And let me tell you, the doctors who actually see medical reps like me, they're the ones who know what they're talking about, because they're up to date with information. They know what's new. They know what's out there. They come to meetings. The doctors who are grouchy and just sit in their office, refuse to see reps, refuse to come to meetings, they're the dangerous ones, because they don't want to know anything new. They're going to stick to their old habits. They're going to treat you the way they used to treat their patients 10 years ago.
And I think what I can take from this conversation, Ruby, is if you go see a doctor and, you know, it hasn't been a pleasant experience, like, don't keep going. And if just find yourself find a new doctor, seriously.
And if they've been a real dick to you, report it.
Report it.
They need to be held accountable.
Accountable, exactly.
Okay, Al, so on the flip side, we've spoken a lot about how medical professionals can be sexist. But something that I do want to touch on as well is how patients can be really sexist towards their medical professionals.
Okay.
So something I'm really thinking about, because again, on this feminist forum that I participate in, this is something I see so much. And it's about how patients, will basically disregard and treat their carers and their nurses like shit. And, if you're a nurse out there or you're a carer, I can almost 100% guarantee you have dealt with some shit before.
For sure.
And why? Why should you have to deal with it? Oh, it's because, you're a nurse or you're a carer, you're being undermined by the patient because, where's the doctor? I don't want anything to do with you.
Yeah.
And you're not taken seriously. Whereas, I know for a damn fact, half of the doctors, out on the wards don't know what the fuck's going on. The nurses are the ones pulling all the hard work, and they're the ones who are actually trustworthy.
Yeah.
I much prefer my nurse over the doctor, because the doctor walks in for 5 minutes and leaves.
5 minutes, they're like, yep, all good. And the nurse is like, yep, all good, cool.
But who's the one actually staying there and looking after you?
Exactly.
It's the nurses, right? So, if you're a nurse or a carer out there and you've experienced something like this before, it's okay to say, no, and that's not okay. There was a really interesting post I read on that forum, and it's basically about this woman who used to work in a nursing home.
Mm-hmm.
And basically, if any of you out there working in a nursing home, some of those, residents can be like batshit crazy, right? Like, they just go off the rails, they do what they want. This woman was not working in a, mental health facility. She was working in a standard generic nursing home.
Mm-hmm.
The patients are quite stable, they're aware, but some of them, just because that's how they are, they like to treat you like shit. And basically, when she started working there, she was told, Mr. Jones over here, Mrs. Smith over here, look, just watch out for them, they're just real mean, or they do this and that and the other. And then she was just like, well, hang on a minute, no, why should I have to tolerate their bullshit just because that's how they are, supposedly?
Yeah.
And she stood her ground, and she said, no, you cannot do this. You cannot grab my ass. You cannot spit on me. You cannot do these things. And she's so firm with her patients now and her residents that they don't go near her. But this is the thing. It's this thing that keeps getting perpetuated when you're, starting a new employment, whether it's at a hospital, whether it's at a, care facility, of just being told about a specific patient and, oh, hey, this is just how they are. So you know what? You should just accept the sexual harassment you're going to receive, because that's just how they are.
Yeah.
Well, guess what? No, I don't fucking have to accept it.
No.
I don't.
Stand your ground, girl.
You have the right to not be harassed at work. That's a basic human right.
Exactly.
So don't stand for it. Just one more thing, Al, which just, I was just reminded of now, and I feel very triggered about it. It's this whole thing about, the women's rights to their body and what decisions that you're able to make about your body without a man. And I've seen countless examples of this. One example I have here is, this poor woman who, she's married, she's only 30, and she has cervical cancer. And in order to treat her cervical cancer, she needs to have a hysterectomy.
Yeah.
Right, so totally remove your uterus, clean it out, get rid of the cancer. Her doctor turned around to her and she was in the consulting room with him. Her husband was waiting outside. And he said, okay, let's bring in your husband and we'll just discuss this all together and make sure that he's okay with this.
Excuse me?
He needs to be okay with it.
I'm sorry, why does my husband need to be okay with me living, having this surgery and surviving the cancer?
Because he owns your uterus.
Okay, sure. Let's get the approval from a man.
This is the thing, and
wow.
this is like something which is extremely prevalent when it's coming to big medical decisions. It's about let's get the partner's permission for this. No, you don't need your partner's permission.
My body. I'm a 30. Well, she was 30, right?
She's
30. 30-year-old woman. Of course, if you're kind of, I don't know, like under 18, you need your parents or whatever. But are you kidding me?
Yeah.
I need my partner's approval?
Imagine that.
Wow.
And it's just like, I have friends who have also decided to become sterile. They want to have their tubes tied because they don't want kids. And the hurdles that they have to jump through just to get that done. It's like, oh, but you might change your mind. Oh, but you might meet a man who wants kids. Oh, but you might do this.
Oh, but if you're a guy and you want to get a vasectomy, no problem.
Ooh.
Snip, snip.
Mr. Vasectomy, get it done in 30 minutes or less.
Very good.
Whatever you like. And this is the thing. There's a huge discrepancy in the way that, doctors basically treat men and women in terms of their own medical decisions. And it's just really appalling. One of my own friends reached out to me and he said to me that, something really simple. He took his partner to the dentist, just the dentist. She was sitting in the chair and the fucking dentist was looking at him and saying, hey, should we do this and this? To her, I'm thinking about doing this and this. Talking like she wasn't even there. Like she's a fucking 4-year-old girl who needs to, get approval from her dad, basically. Like, and he's like, why are you asking me? She's sitting right here.
Good on him.
He stood up.
That's what we need. Good on him. We need more men like that.
And it's just, it blows my mind. So, if you've experienced this, I'm really sorry. It's something I've experienced too. Going out to the medical professional with my partner. I'm pretty firm about it though, and I'm like, it's my choice. You don't have a say in this to the doctor. So put them in their place. They deserve it.
Alrighty, well, I think that's a wrap for today's episode. If you guys have any questions, feel free to reach out to us, or any more stories. Would love to hear about it.
I will also leave a link for you guys to the AHPRA website where you can complain about medical professionals if you have had an awful experience.
That would be really good.
Thank you so much for tuning in, guys, and we look forward to catching up with you next week. Until then, take care.
Bye.